Welcome to Accessible, where we open the door to the people and ideas shaping the disability community. I'm George Gatto.
And I'm Amelia Reigard.
On Accessible, we talk with leaders, advocates, researchers, and individuals with lived experience to explore the issues shaping the disability field.
Accessible is produced in partnership with the Missouri Leadership Education in Neurodevelopmental Disabilities, or LEND, and the Missouri University Center for Excellence in Developmental Disabilities, or UCED for short.
And whether you work in the field, are connected personally to disability, or simply want to better understand how systems can support people with disabilities, Accessible opens the door to conversations that matter. Well, I was excited today because we got to talk with someone that, I have a lot of admiration for, and that was Samantha Montgomery, who's the Director of Service Coordination at the St. Louis Office for Developmental Disability Resources, which, as we will learn, is in St. Louis City. And I thought that was a pretty interesting distinction that we did talk about, the difference between St. Louis City and St. Louis County. I know as a person who lives in Kansas City, it took me a while to get my head wrapped around these two different things. In the same way, maybe it takes people from outside of Kansas City time to figure out, well, what's the difference between Kansas City, Kansas, and Kansas City, Missouri?
Yeah, exactly.
So.
The metropolitan sprawl, right?
Yes.
So things spread out, and we're all one metro, but we've got all these complicated different municipalities at play. So St. Louis Office of DD Resources is actually an SB 40 board, a Senate Bill 40 board here in Missouri. And so we've talked about Senate Bill 40 boards before on the pod, and actually several times, because it's one of the largest ways that DD services are delivered here in the state of Missouri. It's kind of the system in which that happens. But these are local, county, and in this case, city level boards that are funded a bit through property taxes and then also through Medicaid reimbursements, but they're dedicated to supporting people with developmental disabilities. Samantha will talk about, she'll say TCM, which is targeted case management, which is one of the primary services that they offer in St. Louis City. So helping people coordinate all the things they need in order to live independently in their community, the supports and things that they need to thrive, really.
I liked how she talked about all the kind of the services and resources as like a puzzle, and how these funding mechanisms are all kind of like slotting in to create access and opportunities for people with disabilities, and how when we start pulling those threads apart, we start to see that there's so many things that are being funded in ways that you maybe wouldn't know unless you knew about how, like, what SB 40 boards do and where their funding comes from. Or we got into Medicaid and how the reimbursement rates and the cuts to Medicaid fund DD services and how that can impact people. And so she did a lot of good education for us on how all those things work together.
Yeah, I think the puzzle analogy was really nice, I thought, too, and thinking especially on her point on educating people is be aware of the puzzle pieces, right? Because if we do need to change a puzzle piece, then what kind of gap does it lead, and how might we fill that gap? And I think towards the end, she talked a little bit about that innovation piece, right? Which is, change is going to happen in society over time, right? Policies are always going to change, which might change funding, which might change the way services can be delivered. But I think still starting at that base level of like, what is the service? What's the need for people with developmental disabilities? What quality of life do we want for our neighbors, our family members, our community members, and starting there and say, well, how else then could this service or this need be filled? If we're going to change a puzzle piece, there is an opportunity for innovation. So, anyways, just to take away there.
Thinking outside the box a little bit.
I mean, and I guess one of the things that sticks with me from our conversation is just talking about, how services and access to services isn't evenly distributed across the state, and even in St. Louis, we just have, we talk quite a lot about service deserts, and I think this is just such an issue that I personally would really like to learn more about and help to solve if we can, so that there isn't that inequality, or that, maybe that's not the right word, but just the uneven nature of where you can get various services.
Yeah. Lots of opportunities for problem solving and innovation maybe in our future. But I do feel really encouraged just having great minds like Samantha, in that conversation. I think we've had a working relationship on a federal grant with that St. Louis SB40 board for a while now. And just the way I continue to see Samantha and her team problem solve, like to bringing services to that area, to bringing in, like enable dental trucks to do like oral healthcare visits there on the ground. Like they're such an innovative team in helping support people and get their needs met, that I'm glad that she's at the forefront of these conversations in Missouri, because I think that she brings a lot of great insight and thoughts to that. So,
yeah. All right. Well, I hope everyone enjoys this conversation. It was a really good one.
Yeah, for sure.
Well, Samantha, we are so happy to have you join us. And, I've known you for quite a while. It seems like at least a few years through our affiliation with the Missouri Association of County DD Service Boards, and then our working together on the Service Desert Committee. And but I'm just excited to have you here and hear more about you and talk a little bit about that group and others. So welcome to Access.
Thank you. Thanks for thinking of me. I really appreciate it.
Yeah, we're excited. So maybe we could just start with, like, how did you get into the field of developmental disabilities?
Well, it's been a journey. I could tell you that. In college, I can definitely say I was one of those people that did not know what they wanted to do, really, truly, until probably my senior year. And even then, I graduated with a degree in interdisciplinary studies, and my background was sociology, African American studies, and political science. I really did think by the end that I wanted to do something in government, whether that was going to be a politician or something like that. And then by the time I graduated, I had changed my mind about that too. So, I actually I got into sales. I did that for a really long time, working for AT&T. And then I just wanted to do something a little bit more fulfilling for me. And I was talking to a friend of mine who worked for MERS Goodwill. And she said, I think you would be great as a job developer. It kind of encompasses a little bit of sales, but you also get to work with individuals with developmental disabilities. And I thought that would be a really good fit for me. And so I did that. I was very successful at the job development piece. And then the opportunity with DD Resources came open, where I could do more case management, helping people not just in employment, but in other aspects of their lives. Because that's what I would see a lot of times when I was a job developer, is that, yes, people were seeking employment, but there were all these other factors that were basically preventing them from really being successful in employment. So I wanted to do just a little bit more good in those areas. So this job came open as a service advocate here at DD Resources. And I took that, and I've been here ever since. Almost 15 years. This is my 15th.
Wow. Congrats on 15 years. That's pretty significant.
Thank you.
Will you tell us a little bit about DD Resources? So you guys are the Senate Bill 40 board for St. Louis City. Can you talk a little bit about what developmental disability services looks like at the local level?
Yeah. So for us, we do two things. We are a funder. We collect tax levy revenue, which is a very small portion of personal property tax. And we fund services for individuals with developmental disabilities here in St. Louis City. On the other side of things, where I'm the director, we have targeted case management. So we provide case management services for individuals with developmental disabilities, and that's funded through Medicaid. But we focus a lot on employment, on housing, socialization opportunities. So we fund a lot of programs through those agencies. And then with case management, it's a lot of connecting our consumers with those local community resources as well as those state funded resources.
So can you talk a little bit about, I think a lot of us outside of St. Louis don't fully understand that you have St. Louis City and then you have St. Louis County. And can you just talk about the difference between those areas?
So, I mean, it's like a lot of major metropolitan cities where you have like the suburbs, and then you have, your city, your metro area. I can't remember when the city and county separated. I cannot remember the year. I feel like it was sometime in the 60s, maybe, or possibly a little bit before that. They separated into two separate counties. So we have two boards. There's two different boards in those counties. And we operate completely separate. Their money stays with them, our money stays with us. And although there are some services like our MetroLink that that goes a little bit into the county, but it stops at a certain point because the rest of the county doesn't necessarily want to fund that part. So it's just, it's a, I can't explain the separation. It is very different. You would think that it would be kind of all together because we do have a lot of the same interests. People in the county use some St. Louis City services, some of the attractions like the zoo and things like that. And then it's vice versa for people in the city that do things out in the county. And trust me, there's a lot of hubbub about who should be able to do what. But, I do know that both governments, are in good contact with one another and they do try to work together on a lot of topics because, when things kind of go wrong in the city, it kind of trickles over into the county in the same. So I think it's good that they, do have that working relationship. Obviously, on the state levels, we have, our legislators for the different areas, and then we have our senators and Congress people in Congress, but they work together for both areas. So that we do have in common. That part is not necessarily separated. But yeah, I can't. There's no explanation for it. I really don't have an explanation for it. I know that there's talk about merging both the county and the city, but they've been talking about that for years. I don't necessarily see that happening. But you never.
Well, one of the things I remember I don't know, that I learned from you, because I hadn't really thought about too much in our work with service deserts.
Mhm.
I guess where I was wondering is, does that separation between city and county create service deserts or
I think it can create service deserts. So there are lots of things that are available in St. Louis County that aren't necessarily available in St. Louis City. And I don't know if that's because, the county has a lot more space, obviously. We have limited space in the city. And there are some infrastructure issues, obviously, that also need to be fixed. But that's because St. Louis is such an old city, right? We're an old city. We have a lot of this beautiful architecture that nobody wants to touch or, make changes to. So there's that accessibility piece, especially for people with disabilities. I know one of the big things that we always talk about, George, is the housing desert that we have here in St. Louis City, which you would think we would not have that type of desert here because it is a metro area. We have lots of buildings, lots of apartments and things that can be used and transformed into accessible housing. It's just not happening as quickly as it does in the county. There's a lot more money in the county. It's just kind of the nature of things. The population has shifted as well from city to county, so obviously that increases their revenue quite a bit. So they have access to a lot more services. There are a lot more agencies out there. Accessibility to those services are a little bit easier. I know that some agencies, they operate both in the county and the city. It's just that agency might be located so far away that it's difficult for people to travel into the city, or it might be not very cost effective. They do try to do things where they put in, maybe a clinic that's close to the city that people can get to, but it's still not necessarily meeting that need. So I think that's the migration, the infrastructure, all of that plays a part into what's available in the city versus what's available in the county.
Yeah. Samantha, when I introduced the SB40 board, did I say county? I'm like second guessing myself that I said St. Louis County.
I think you said St. Louis.
Did I say city? Okay.
I think
I think it's a common in our work together. It's a common thing that we're constantly correcting is somebody writes St. Louis County and I have to be like, it's St. Louis City. And then I was like, wait, did I just do it?
Yeah. I think also for some agencies that might not necessarily be familiar with that St. Louis City, St. Louis County situation, when they sign on to provide services, and we'll call them and we're just like, hey, you have services in St. Louis County, but you don't have them in St. Louis City. They're like, yes, we do. We're in St. Louis. And it's like, well, no, you need to understand that there's two separate counties, even though it's divided by literally a street. It's not the same thing. So I think just kind of educating some of the agencies about that as well is important. Just making sure that they understand that, providing services in St. Louis doesn't just necessarily mean St. Louis County. It also should move over into St. Louis City. So
I think what's interesting is during this season of Accessible, we had a conversation with Libby Trammell from the Missouri Rural Health Association, and we were talking about the dearth of resources out in rural Missouri. And here we are talking with you, Samantha, in St. Louis City, and we could say the same thing in terms of a lack of resources. So I wonder if you would talk a little bit about how service deserts are affecting people with developmental disabilities in St. Louis City from what you've seen and some of the challenges that you and George and others at MACTDS are trying to work on.
So you want people to be able to live in their home for as long as they want to. You want people to be able to live where they want to live, close to family, close to those natural supports that do take a little bit of a burden off of those community and state-funded resources. It's just that the services are not available. So they're either having to move far away from their natural resources or just forego the services altogether. And that causes other crises within their life. If somebody can't get the therapies that they need to be able to, move around and be more mobile and just, have that accessibility, that mobility, because they can't drive all the way out to, Baldwin from North St. Louis. It's a huge barrier to them. So they'll just forego the service, even though that they need the service, and they might need the service to go to work and be independent, to learn how to maintain their household. And it's a real it's a real crisis to me, um, because the services are available. Um, they're just not available where all of the people necessarily need them. And it definitely it keeps people kind of either trapped in their home or, like I said, just moved very far away from their natural resources. Residential or community living is definitely one of those things. We have a number of people here that need residential placement, and there are homes available, but they're in, Jefferson County, or far in St. Louis County, or somewhere I'd never even heard of, Missouri. And they're like, I don't want to live there. I want to live right here. My mom lives around the corner. She can come over and help me whenever I need. As we know, the state has parameters about staffing and those staffing ratios. And so you can't have one-to-one staffing 24 hours a day. So if your natural supports were able to kind of come in and assist every once in a while, or if you were able to go to work for a few hours or go to a day program for a few hours, all of that takes that burden and that funding issue out of the scenario. So I just think the more services you have in areas, the more people with developmental disabilities can thrive. If those services are lacking, you see declines in health, you see declines in just the functionality of people, the way that they move about. You see disconnects in relationships and things like that. So it's just it's very, very important that everybody have access to as many services as possible.
Yeah. So can you talk a little bit like what, and maybe there isn't a relationship, but I'm wondering like what is the relationship then between Medicaid and access to services?
So, like, Medicaid is one of the main funders of disability supports. I'm not sure that everybody knows that. I think sometimes people just are like, well, services are here, and, they just expect them to be there when they need to be there. But Medicaid is a huge funder. Its rules, the reimbursement rates, um, they influence what services the agencies can provide realistically. And so it's extremely important. It's like when your reimbursement rates don't keep up, when the cost of delivering services, goes way up, the providers will struggle to, hire staff, keep programs open, and that ultimately affects individuals with developmental disabilities or any disability really. It's for your nursing homes. It pays for those adult daycares that people go to a lot. It's just that people don't realize that Medicaid pays for so much. For us, Medicaid pays for targeted case management. That is how we are funded. If, our reimbursement rate is another kind of an issue that we have specifically. And it makes it it takes away from our SB40 board, because our SB40 board then is supplementing our TCM services because the rate does not keep up. And because our board recognizes how important targeted case management services are for people with developmental disabilities in the city and anywhere, they have agreed to continue that supplementation. But it gets, the more we go and the higher costs are for services, the more burdensome it is for, our SB40 board, because that's kind of taking away a little bit of money for people for those funded services that people need as well. Because our funded services can kind of close the gap, right? You have your community resources, you have your state funded resources, but not everybody qualifies for all of those things. So the SB40 board closes that gap, if you will. So it's just important that, they keep as much money as they possibly can. And our Medicaid funding, should sustain us.
Often when people hear about Medicaid, I think that there's a lack of understanding of what all it funds. And a lot of times it's just mostly talked about as, a healthcare insurance for people living at or below the poverty line. And we don't necessarily see or hear a lot about, maybe in recent months, we have heard more education advocacy about it, but how it funds developmental disability services that a lot of people rely on in the community. And once you've aged out of the school system, right? That's where your services are going to come from, or through those county level targeted case management type opportunities. And so I think we've talked a little bit about advocacy and education and the relationship they share. So Samantha, I guess I wonder if you'd talk a little bit about, especially with kind of federal conversations around changes to Medicaid, how have you guys been engaging in education around this topic so people understand when we talk about cuts to Medicaid, how it might impact DD services?
Like you said, the biggest thing that we can do is educate people. We never tell people, oh, you absolutely have to vote this way or that way. That's not what we're here for. We are here just to, make sure that we are educating people and making sure that they understand everything, where their money is going, because that's really the big issue for people. It's like, I'm paying all these taxes. Where is my money going? Like, how is it being spent? And I think that that's the biggest thing that you can do for the public is just to educate them and give them specifics. You pay personal property tax. These are all the things that it pays for in your area. You pay income tax. These are all the things that it pays for. This is how it works in the state of Missouri. This is how, we get our revenue, so on and so forth. And it's, I think it's helpful when people understand what those things are, what they pay for, like what Medicaid is, how it's funded. They look at it a little bit differently. They're like, oh, that is something that my friend uses, or it's something that I might have to use in the future. So I want to make sure that it's still there. So it's education is probably like the biggest thing that that we can do for people, not just the public, but also our legislators. We do go and we talk with them, and it's the same thing. We talk about our services, what we do, how we're funded, and and we give them like a real world impact on, if when we cut this is what happens. If you increase this is what could happen, and then they make their choices as they will. But the biggest thing that we can do is just educate people, and that's why it's really, really important. It's not political. It's just the mechanics of the system and just making sure that people really understand it, because it is a puzzle, right? You're just gonna want to make sure that everybody knows all of the pieces so that they can put the full picture together.
Yeah, a puzzle's a great analogy. I think even after all the years of working in this field and in Missouri, I feel like I'm constantly learning like the pieces of the puzzle and how they all fit together. And so it can be feel like an undertaking, but I think that education piece is really important. Something you guys are doing well right now.
Can you talk a little bit more about just that public or the local funding piece, and what are some of those local funding mechanisms and how they help sustain the disability services?
As far as just what we do, or
Yeah, and just Senate Bill 40 boards in general. I guess kind of what I'm curious about is I know that there is this new bill statewide that's focused on sort of those property taxes, and
it's just making sure that people know what it pays for. And even then, we could talk till we're blue in the face to people, right? But one of the things that I feel like is even more impactful for legislators and some of the public is just hearing real stories from real people, right? So we have a lot of very active families that like to, just share their story. We have legislative coffees with our legislators. They're able to come and kind of meet with their constituents and just hear what we do from us, as well as some of the people that uh, we fund services for. So some of our consumers can get up and share their stories and share their successes, really, about how this particular service has helped them and has changed their life and why it's important and why they would like to keep it. So I think that's super impactful.
Yeah. Well, the thing that gets me kind of fired up is that, and I just, is this idea that we're looking at, significantly cutting Medicaid. Now there's also this, we need, or there's this movement to cut property taxes. And, we all, certainly on this call, care deeply about people with IDD, have probably family members or friends that we care about, and we see how important these things are to them. And I just don't know, where would services come from? How would services be paid for if we take away these supports?
Yeah. I know that organizations like MagDDS, Starling, are working really, really diligently um, to have those conversations in Jefferson City specifically, and just saying, okay, well, if this funding goes away, what will we do? Like, what is the next step? I know that obviously your revenue is going to have to come from somewhere, right? I know that the proposals on the table right now, I do believe, are I think a sales tax increase. So just making sure that we are paying attention to all of those things. And if something would have to shift, if we were to move to more of a sales tax based revenue, just making sure that there's a replacement for the personal property tax if we move to a sales tax. Currently, that is not the statute. But I do know that that is something that they're working on. I don't think anybody wants people with disabilities of any kind to suffer, and I don't think that because they're not everybody's not really sure or understanding what these taxes actually pay for, they are a little bit more willing to just be like, oh, we can just get rid of this or we can get rid of that. But as soon as they more so understand that the impact that it's going to have on people with disabilities, that definitely moves the needle the other way. I do believe there was it Senator Rusty Black recently sent something out about the personal property tax or the income tax or just the cuts that were being proposed. But that's after he's been spending a lot of time, with Starling, with MagDDS, just understanding what the cuts will do and how much more it could potentially cost the state if those services disappear. I think that's probably the biggest education piece, because it's like, okay, these services will go away, and then what? Then what happens? It's like, if you cut funding or you cut funding to the point where we have to have a wait list for residential placement or community living, what happens to people who desperately need that service? A lot of times they end up in the hospital, and they stay there and they have nowhere to go, or they end up in the nursing home, which is a completely inappropriate placement for people. All of that costs way more than it would if they were to just go into community living. We don't have HAB centers anymore. You can't institutionalize people anymore, and nobody wants to do that. You want people to live out in their community, with their family, with their natural supports, with their friends. engaging in their community, and without those certain services, those in-home services and the community placement services, people end up in places that they don't belong and that they should not be, and it will cost the state a significant amount more if people end up in those places.
Those are good points. And I feel like I've said this before. I don't know if it was in a call with you, Samantha, or maybe I've said it on the podcast before, but it's just like, you'll never see the money the money you save, I guess, when you do sort of these more preventive and proactive services. But there is a cost, right, to not providing them, and that we'll all feel it, right? Like there's the human cost, right? Like the way it will impact our loved ones or people who rely on those services. And then there will be a line item in the budget cost. And so it's like, can we, continue to provide these great services in a way that's cost effective to the state, more cost effective than having these sort of retroactive, like we said, criminal justice system, hospital system, institutionalization, which will cost way more money and drastically impacts the quality of life of Missourians, right, and their families. And it's good to keep in mind and good to keep at the forefront of our policymakers' minds too.
And I think we understand that costs are high. They just are, just across the board. But I think there is opportunity in collaboration. I think there's opportunity in maybe some state collaboration, a little bit more with local community resources, in a way that I'm not sure that we are doing currently. The SB40 boards do all that they can to connect. I know we have an initiative within our strategic plan to really connect with resources that we've never seen before, to try to bring in some new opportunities. But I also think that the state has an opportunity to kind of do the same thing. And I think that's something with our service deserts initiative that we're kind of looking at. Like, how do we build capacity and not increase costs at the same time so that they don't tell us no, basically. So it's just really but trying to think outside the box and saying, okay, well, if we can bring in maybe this community resource, and it can work in tandem with this state funded resource, then, we can possibly close that gap. But it's, having a better understanding what local resources are in every single county, making sure that the people who are making those decisions also know what those local resources are, and making sure that the local resources have a better understanding of what's available statewide, state funded wise.
So for people who are, really interested in advocating, or just, figuring out what they can do, like whether it's a professional or a family member, what are some of the sort of things that people can do to advocate for their family members, for the people they serve? Or do you have any recommendations for us on that?
The biggest thing is, everybody's got their legislators' information, just talking to them and just having that conversation. It doesn't need to be like a shouting match. It doesn't need to be, you need to do this and you need to vote this way. It's really just, here's my story. I just wanted to share with you. Thank you for listening. That's all it needs to be. I really do think it can be that simple. I really do think that is the best form of advocacy, is making sure that you fully understand how the system works, so that you can explain it to others that have the power to make that change. And when we teach our families about their options, we're advocating. When we help professionals understand best practices, we're advocating. When we explain disability services to the public, kind of reduce stigma, that's also advocacy. When we're going up for our legislative days, even our celebrations of, the ADA, and just disability services in general. This month is DD Awareness Month, just making sure that we are, celebrating people with developmental disabilities and showing the public, all of the wonderful things that people with IDD can do. That's advocating. And I think it's advocating in a positive way, and it's shining a positive light on folks with DD, their families, their support systems, and the services that they receive. And I think that is the best way for all of the public and those, in Jefferson City and, in Washington, D.C. to really see, all of the good things that are happening and why they're important and why they should be funded and continued.
All right. Well, Samantha, thank you so much for being with us today. And if people want to get in touch with you or learn more about your work, or how can they do that?
Well, our website is scldd.org. You can go there. It has all the information on it about all of our services, the SB40 services, as well as TCM, how to get into TCM services, how to, it has all of the agency information for all the agencies that we fund. All of their programs are listed, these full descriptions, all of that. So that's probably the easiest way to get all of our information. We also have a Facebook and Instagram account so that you can, look at both of those and just, check us out.
Right.
All of our, if we have an event, if we have any celebrations, any highlights, all of that's on our social media accounts.
Awesome. Well, thank you so much for joining us today.
Thank you very much for having me. I really appreciate it. And I appreciate being able to talk about developmental disability services and our consumers. They're awesome.
Great. All right. See you soon.
See you soon. Thank you.
We're excited to announce that Accessible has a book club. So join the Accessible team for a live virtual discussion of Being Human, Judy Human's powerful memoir on disability rights, leadership, and collective action.
We'll gather on April 2nd, starting at 6 p.m. Central Standard Time on Zoom. And the conversation is open to students, faculty, staff, and members of the public. To register, check out the link in our show notes.
And if you can't join us live, no worries. We'll share the conversation later as an episode of the Accessible podcast and on the UMKC Institute for Human Development YouTube channel.
Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gatto, Amelia Reigard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri USED. Accessible is a joint project between the Missouri USED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcasts. Join us next time to hear more insights and ideas from leaders in the disability world.